All right. It looks like it's slowing down. We'll go ahead and get started now. Um, Thank you all for joining us for the July Clinical Research Connections meeting. This month we have Christine and Richard to talk to us about COI disclosures, and then Lori Hopper is here to talk about HIPAA training. So Christine, I'll hand off to you. Matt, do you have the presentation?
I do, and it should be sharing right now.
Great, thanks, Matt. Thanks, everyone. Good afternoon. Thanks for having me today and the rest of us as well. So I'm going to talk about conflict of interest to start. Just so you know where I sit, I'm in the Office of Regulatory Compliance. The conflict of interest office is one of the many units within that group, and we have the oversight and responsibility for conflict of interest program at the campus, both campuses, Anschutz and Denver. So Matt, go ahead. Next slide. So just an overview of what we do. We review the annual conflict of interest disclosures, and there's quite a few that come into the pipeline. Provide support with the annual disclosure process, which is coming up in about 3 weeks, August 10th. We create management plans and also review and create letters for significant financial interests. And those are those interests that could potentially create conflicts with which we have to manage for research projects and other types of things. We monitor those external interests, coordinate our monthly conflict of interest committee that meets once a month at the present time whenever we have new conflict of interest management plans to have reviewed and approved. Do some training, and then we work really closely with our other institutional offices such as COMERB, External IRB, Grants and Contracts, CRAO, Innovations. Really everyone centrally located that could have a role in research and projects, and then work with to provide some technical support of the InfoEd and the ERA system. So we're one of the 3 modules that are within the InfoEd suite. So that's in addition to the sponsor projects, grants and contracts, and then human subjects as well. Next slide, please. So this is just a statement I took from our conflict of interest policy. And really what I want to emphasize with this is we have a lot of experts in many areas. That expertise is really beneficial to those folks at the federal, state, and local level. However, if we have folks doing outside activities, there's a potential to create a conflict, or at least the perception of a conflict, or even conflict of interest or conflict of commitment. So we have created a process for identifying actual conflicts as well as perceived conflicts. And we do this on an annual basis. So in addition to our locally administered conflict of interest policy program, we have an administrative policy statement at the University of Colorado system level, which really gives us our charge, so to speak, to create the conflict of interest program and manage it and monitor all of those different disclosures coming in the pipeline. Next slide, please. So a few different conflicts I'm going to touch on today. Tangible, those are those ones that tend to be more financial or monetary in nature. Intangible, those are more along the lines of, maybe not an actual outside activity that is paying somebody, but things that could impact academic or other professional activities at the institution. A conflict of commitment, and then also institutional conflict of interest. Because we have a new policy that's relevant to that. So we'll just touch on that briefly at the end. Next slide, please. All right, so what is a conflict of interest? It's a type of situation in which an outside activity, typically, someone getting paid to do something such as consulting, being paid to be on an advisory board. What happens is those outside activities look like they do interfere with a person's institutional activities, or they have the appearance of interfering. So in that case, when we see these conflicts come in during the annual disclosure process, we go through an evaluation process to determine if there is an actual or even a perceived conflict that we might need to manage at either a research level, administration level, or others. Maybe there's a conflict in teaching. All kinds of things could bubble up as far as how that goes. But again, conflicts of interest typically are monetary in nature, financial in nature. So think consulting, think maybe an outside company. We have a fair number of startup companies that faculty have on campus, things like that. Next slide, please. All right, conflict of commitment. These are a little more intangible in nature. They may be harder to kind of articulate or think about, but these are things that, these are outside activities which maybe they don't pay a person, but they do appear to impact a university's person's commitment to their institutional duties or responsibilities. So say somebody has a consulting agreement, but it's a disproportionate amount of time, or they're getting paid way more than fair market value. Maybe somebody has a startup company, and that startup company takes, 40 hours per week, and that really impinges on the person's ability to do their institutional responsibilities or to really meet the mission or the goals of the institution. Also, there's a whole policy on use of university resources with respect to outside activities. And so that's another area in which a conflict could come up from the commitment standpoint, as well as intellectual property. Next slide, please. So why are these such a concern? Conflicts, they're a concern if we don't know about them. They're not necessarily a bad thing if we have the ability to manage them in an appropriate manner. But if these conflicts come up and we're not properly managing, we could see all kinds of issues come up. Professional issues, patient, public trust, and research could be real damage to an institution's reputation if there's a conflict that the institution doesn't know about or the institution isn't properly managing. This could lead to actual bias in research or an appearance of bias as well. Could call into question research results. In some extreme cases, and it's been a while, I think, since we've seen any of these cases, but failure to disclose a conflict or an outside activity has resulted in forfeiture of grants. Many years ago, there was a very prominent researcher at Emory who lost a multi-million-dollar grant because he failed to disclose not only to his institution, but also to the NIH. And then COI and peer review, that can come up, kind of an inherent bias could creep in during peer review if we aren't aware of outside activities that individuals are doing. Another place this comes up, and I don't have it on the slide, are things like publications and presentations. If somebody is working with an outside company and maybe they have done research with them, we want to make sure that is fully disclosed in those types of activities. Next slide, please. So managing conflict of interest. These are some of the mechanisms we typically will engage in when we see a conflict with which we determine there's a significant financial interest, creates a conflict because there's a research project or something of that nature, and then we determine we need to manage it. So fundamental to this, we need to make sure there is disclosure of a researcher's financial interest to human subject participants. So this means in the informed consent, that financial relationship needs to be apparent and needs to be communicated to the study subject so they have the ability to make an informed decision, ask more questions about it, things of that nature. And we work closely with the IRB of record when we are reviewing management plans because they also have a role in that when they're reviewing and approving protocols. I just mentioned making sure we're disclosing those financial relationships in presentations and written and oral publications, abstracts, that's pretty simple to do. Just you put a slide that says so-and-so, I have a relationship with this company, and then that helps, really that transparency perspective that we're trying to get at. Independent monitoring of research by independent reviewers. Maybe we'll pull in somebody external to a project so that they can look at it, evaluate it to make sure data monitoring or data management, things like that, analysis, make sure that those are all independent and that we don't have biases creeping in there. At times, we might limit the dollar amount of a financial interest. In extreme cases, maybe there's a severing of the relationship that has created that actual or perceived conflict. And then really limiting the person who is conflicted, limiting their role on certain aspects of the research project. So maybe we limit somebody's ability to enroll or to consent. It really depends on the actual situation, what the relationship is. Is that person the prime PI on a clinical trial, for example? So there's all these factors we take into place when we're reviewing and creating management plans for particular projects. Next slide, please. So what has to be disclosed? Well, we have a policy that all relationships that are paid and unpaid that reasonably relate to a person's institutional responsibilities need to be disclosed so that we can review and manage if needed. This includes those outside activities and interests of spouses or domestic partners, as well as dependent children. We're looking at conflicts in relationships and disclosures in arrears, so to speak. So it's kind of a 12-month look back period, and then we're managing to that 12 months. And then we also like to know what's happening in the next 12 months. And this is an annual disclosure process. So as I mentioned, the next disclosure process is August 10th. And so we have a time frame in which we're collecting all of these disclosures. We also want to remind people that within 30 days of a change or addition or elimination of a disclosure of an outside interest, that conflict of interest disclosure should be updated. Next slide, please. So who is required? Well, by far the biggest bucket are faculty. So faculty who are assistant professor or higher are automatically pulled into our disclosure bucket, so to speak. We then have others, folks who are officers, business people, really individuals who have fiscal responsibility, folks who are on research, PIs, co-investigators, things like that. We also collect COI disclosures for a fair number of affiliates. We also have research committee members do disclosures. Really anybody who could potentially bias the design, conduct, or analysis of research, and then others upon the request of the COI office. So every once in a while we have folks who may not be pulled into our policy, but we want to have them disclosed because they are engaged in some type of outside activity, and it's really is beneficial to everybody involved if we could have that disclosed. Next slide, please. All right, so when is a disclosure due? So we have a few different policies. Well, we have different offices who help us kind of facilitate and get these in the door. So grant personnel, the policy that's created in grants and contracts office is to have that disclosure before the proposal sent to applicable sponsors. For IRB, before the protocol submission will be reviewed, we will make sure that the disclosure has been done, and at times that's often a trigger for us to do a management plan. New hires within 60 days are expected to do a disclosure if they're covered by the policy. And then if you somehow get through these three loops, then everybody else, we have a due date of October 31st. And that's been pretty standard for the last several years. Next slide, please. So what do you disclose? Everything, even if you're not getting paid for it. People have to just make a disclosure of an outside activity. So again, this is something, you're disclosing. We have people disclose if they are engaged in an outside activity that reasonably relates to their institutional responsibility. So there's a bit of a nexus there. It's not just this, my dog washing business, but it's something if they're engaged in some type of activity that could potentially, impact or really kind of, parallel or really cross over into what the person is doing for the university. We're going to want to make sure they are doing a disclosure. Could we do some polling questions now? All right, just 2 questions. Just take whatever, Matt, whatever you think we need for time, just on these couple of questions.
Looks like the answers are slowly coming in. We'll give it another minute or so. If people can see answers on my screen. I think that's a good amount. There we go. Looks like number one, most people put conflict of interest. And number two, there was more of a wide range between 9,000 being the most answered and then 500, 52, 80, and 99.
Yep. So you're right. So the first answer is conflict of interest. Good job. And then, yeah, number two, we do around 9,000, we collect around 9,000 disclosures on an annual basis, which is a pretty extraordinary number given the number of full-time COI coordinators we have. That doesn't mean we look at everyone, because that would be a whole nother discussion. But we have about 9,000 disclosures come in, not only from our faculty and our employees, but also from our affiliates, from other individuals who may be external to research, but who also do need to do a COI disclosure for certain reasons. So quite a big number that we are dealing with on an annual basis. So we're about to get into the thick of it pretty soon. So just a few more slides. Matt, ready for the next one. I just want to mention an institutional conflict of interest. So this is it's a concept that's been out there for a while, but we just recently implemented a new policy, March 1st of this year. It's specific to the Anschutz Medical Campus. So ICOI really arises when the interests of the university potentially conflict with those individuals who are doing certain activities. So this is really applicable to senior officials who have certain decision-making authority involving university type of investment. So let's go to the next slide and look at what this means. Oh, yeah, just wanted to point out there's been a few in recent about 4 years ago. Memorial Sloan Kettering was by far a really significant institutional conflict of interest. So if you ever have time to look into that, I highly recommend that. Let's go to the next slide. So the institutional conflict of interest policy, the reason we have this, we have very innovative faculty. And so we also have a very innovative tech transfer office called CU Innovations. So they're out there doing a whole lot with respect to creating new companies, creating new technologies and things of that nature. So we then have created that policy so that we can review and manage those types of institutional conflicts that do arise from time to time. Let's go to the next slide. So it applies to officers of the university. So those are certain officers for the campus at vice chancellor, assistant vice chancellor levels, deans, folks like that. It also applies to certain department chairs, as well as division heads and section heads. And so it's really from your department perspective, it's your leadership group to whom this new policy could apply. And so we're in the process of really setting this up with respect to how we review and manage things. But these are really the key individuals who need to be aware of this new policy. Let's jump to the next slide. So what this means is when we know of a potential institutional conflict, we have to review and evaluate it and put a management plan in place if needed. So just like we have individual conflict of interest management plans, we also have management plans for institutional conflicts. We want to make sure that those are being reviewed and really managed appropriately. We want to make sure it's fully disclosed. You know, we're not necessarily endorsing, but that we know the difference between what we're doing with respect to an officer being involved with a type of institutional conflict or institutional interest, so to speak, and that we're fully disclosing that to all those individuals who are involved. So that's kind of the high level what we're trying to accomplish with respect to ICOI. Next slide. That might be it. All right. Any questions?
Yeah, if anybody has any questions, feel free to either put them in chat or if it's not too rowdy, you can just unmute. We'll give everybody a minute or two to ask Christine questions. And then we'll have some contact information and email out these slides in this video later this week. So if you have any questions for Christine that you think of at a later time, You can always reach out there. Looks like we have a question in chat. For new hires that just submitted a COI form, do we need to do it again then in August?
Yes. So once you have done it, it always restarts, so to speak, in August. So if you have done it recently, it's a new disclosure period for the 2022-23 time period. So it needs to be resubmitted.
Great. And any more questions for Christine? If not, we'll move on to Richard. And Richard, feel free to take it away.
Okay, let me see, and I will share my screen. Okay, so Matt, let me know if you guys can see this REDCap presentation slideshow.
Looks good.
Okay, all right, so of course, my name is Richard Akoto. I've actually been a privacy analyst here for almost 2 years now, and I'm definitely enjoying my role here. Dealing with all things HIPAA related, dealing with agreements, reviewing agreements, and in this specific presentation, I'll be discussing what exactly REDCap is and how it kind of ties into the work that I'm doing and that we do. And if you do need to utilize this later on in your job. So yeah, thank you again, of course, for coming and attending to this presentation. So the next slide should be, let me see. So why the need for REDCap? So it is a REDCap. It is a software. It's a tool for data collection, and it's evolved throughout the years, and it's being used throughout the world. Actually, in this image here, we see here 146 countries, 1.5 million projects are being utilized with this REDCap tool. Just about over 2.2 million users utilize REDCap, and there are about 20,000 articles that use or that have to deal with REDCap and deal with incredibly quite a lot of institutions, including this one, of course, the University of Colorado, Anschutz Medical Campus. And maybe in your role, you may need to submit a data submission agreement, and I'll kind of discuss a little bit further about what examples there are of data submission agreements to proceed with research studies or other business needs, because this tool has been extremely helpful for our department, the Office of Regulatory Compliance, and definitely for this campus to kind of silo the many agreements that we come through and that we review throughout the year. And just some additional information, REDCap is a free to use, easy to use tool. It has flexible uses. There's a lot of accessibility, especially on the back end, to edit information or to make information more readily available for us to kind of sort through. So it's an extremely valuable tool for us. All right, so the next slide is data sharing agreement. So of course, REDCap, we use REDCap in our instance to collect data sharing agreements. So the three main data sharing agreements that we do use are BAAs, DUAs, and DTUAs. And of course, if you've been working in any capacity in the work field, you are coming across quite a lot of acronyms. So of course, BAA stands for Business Associate Agreements, DUAs, Data Use Agreements, and then DTUAs are Data Transfer Use Agreements. So BAAs or Business Associate Agreements generally requires an institution or a covered entity and another institution or business associate to have a sort of agreement about what information will be shared between the parties, and then the best, most complete way to safeguard the protected health information or the data that will be used in these agreements. And oftentimes they do have a back and forth in terms of what stipulations they'll want to place into the agreement so that each party knows exactly what is being permitted and or not being permitted and what parameters the data will be sent through. BAAs also serve to clarify and limit as appropriate the permissible uses and disclosures of protected health information by an institution. And it's based on a relationship between the parties and the activities or services being performed by one institution on behalf of another or between each other. A business associate our business associate agreement is something that is within HIPAA, or HIPAA is used as a regulatory federal privacy regulation, and it's a feature that could or is used to bolster and protect PHI for patients, because of course, especially as an institution, a medical institution, we want to be helping the other institutions, the hospitals, as much as possible when they need to use data. And when we do need to use the data, receive it, or give it away, we need to make sure that it's being protected as much as possible. So a business associate makes it, a business associate agreement makes sure that we are not under a breach of HIPAA, which would be very bad if we were to be doing so. And a data use agreement is an agreement where the data at play is a limited data set, and it is shared and used, and there are protections outlined in this agreement. A specific type of agreement which is required within the HIPAA privacy rule, and it must be entered into before there is any use or disclosure of a limited data set from a medical record to an outside institution or party for one of three reasons. And one of the main reasons, of course, is research. The second one is public health. And the third is healthcare operations and purposes. Let's see. And some additional information, HIPAA and or covered entities, or covered entities like this one, the University of Colorado, or even more specifically, a hybrid covered entity must enter into a DUA with any institution, organization, or entity to whom it discloses or transmits a limited data set. And just an additional information about what exactly the limited data sets involve. They are data sets stripped of certain specific direct identifiers that are specified in the privacy rules, such as like name, date of birth, MRN, those kind of things. So those are kind of stripped out of the data set, and some data sets that won't likely be able to identify or very directly to identify a patient, those are stripped away. And the question is, how exactly do we get to the portal? We have, well, myself and Laura, we often review and edit our website. It's our HIPAA home website, and it contains the portal. So we can go, and of course you'll be presented with this presentation as well. You can either select this link, which is redcap.ucdenver.edu, and through our website you can click this golden banner that says, hey, visit the portal, and then some additional resources about what exactly BAAs are, DUAs, and if needed, an MTA or a material transfer agreement. And what you will see when you do pop up into when you click the portal, for example, you will pop up and you'll see this screen, and it has some information saying, hey, this is a data sharing request portal. Welcome to University of Colorado, Denver. Some additional information about actually filling out the form. And actually a very, I guess, important thing to note is that, hey, there is a free text field to add or include more additional information that maybe myself or Christine will need to review as it relates to any submissions that you have on this portal. In this specific REDCap portal, we do not submit, or we do not review any CDAs or confidentiality certificates or non-monetary research collaborations or MTAs. If you do need to submit a form like this, you need to go to this specific link, which is ucdenverdata.formstack.com. So that will be the specific place to submit those kind of submissions. And when you do scroll down through this portal, you'll see some information that needs to be filled out. Oftentimes it will be an agreement where it involves a research protocol. A COMR protocol number would need to be placed here. And of course, if you do not, or if this agreement is not involve a protocol number, then you could place an additional, like a brief explanation somewhere down in the portal saying, hey, this does not involve a COMR protocol number. And then you would, as a submitter, you would place your name, phone number, email address, the department that you work with, and the name of the collaborating institution. So this kind of information is extremely important so that we know, hey, like who is submitting this, and how do we contact you if we have additional questions. And then this portion down here, or name of collaborating institution, is very important, because eventually when these agreements are being reviewed and sent back to the party, which is either like receiving data or information, we need to know exactly what institution it is. It could be a university clear across the country. So we need to kind of know exactly who is involved here. And then one of the questions that is placed in the portal is, what type of agreement do you need? So is it a BAA, a DUA, or a DTUA? And of course, there are additional options here for, like, example, a DB-GAP, which refers to the NIH, or National Institute of Health. And they maintain a database of like samples and more specific research-related, I guess, information. And if that is necessary, to click, all you do is you click that option saying, hey, I am selecting DHHA, a non-employment agreement, or DB-GAP. And then if it is a yes, we wouldn't actually need to fill out the rest of the form. So you kind of are able to skip this form entirely if you do have to submit a DHHA, or a non-employment agreement, or a DTUA. And then if it relates to a research protocol, the PI name, or PI phone number and email address will be placed there as a contact for us to know. And more additional information that would need to be filled through this REDCap portal is the title of the protocol as needed, the description of the data, PHI, and data elements. So when it relates to BAAs, DUAs, and the transmission of PHI, this is a very crucial portion that needs to be filled out, exactly what kind of information will be exchanged between institutions. Is it names, locations, dates, numbers, fax numbers, account numbers, etc. Let's see. All right, another portion that we would, of course, you would need to fill out is where the data, specifically the use, what reason will the data need to be used for? Is CU providing it, or are we receiving it? Or is there going to be an exchange where we're both providing and receiving? So those are some things to keep in mind. And then who would be managing the data? And then of course, their name, their phone number, and email. So of course, like I think I had in the previous slide, information. So as much information as possible is necessary. Now, I've definitely learned in this specific role, documentation is extremely important, so that we can keep track of what things we're doing. Let me see. Another section of the REDCap form that we need to fill out is the other entity. So if we're CU and we're exchanging or receiving, or sorry, providing or exchanging, providing or receiving data with another entity, we will need to obtain their contact information, email, phone number, and their name, so we can get the agreement to them. Because if there's no information about who they are, they can't get it. So, and another portion here is the data security. So here we have a little bit of a description of the system or applications that will be used for collection, storage, and the management of the data, and the storage locations. There are a number of storage locations. REDCap. REDCap isn't just strictly used for almost as a silo for data sharing agreements, but for placing actual data into REDCap, that is an option that institutions use for their needs. OneDrives, flash drives, hard copies, encrypted laptops, and all these things. And I guess maybe more specifically in the role that I do day to day, it's important that if you do need to use these kind of applications, that these are stored in the correct manner, because we don't want to lose track of information that's placed on a physical copy. And then the information here that would need to be filled out are the data transmission method or methods, the data on the mobile device, and if there is an accessibility to the data through the internet. So, and then once you fill out all those items, all these line items, then you would upload any template or any agreement. So either like a BAA, DUA, or other agreements, and any other underlying agreements. And then once you fill that out, you upload it. And then you place any additional information in this free text box. And then you can submit it immediately, or if you would need, or if you at the moment don't have this agreement, or there's certain information that you have yet to fill out or obtain, then you'll make sure to save and return later. And actually, even when, of course, typically when it is submitted, we receive it on the back end. We actually receive an email, and then we go directly to the REDCap and see, hey, here's the information, here's the BAA or the DUA, and then we proceed with those agreements or reviewing those agreements. But if we need to collect, or if we don't have certain information that I did mention before, we can just email you specifically and try to get that. And this is an example of a submission. So this is how we receive it. So once you place submit, then the PI name is we receive the PI name based on what the information, the protocol number, the name, and then the entity. And then a few of us, Laura, myself, Christine, Matt, were able to, we get notified, and then we try to address submission and try to get these agreements through the system as soon as possible. And here are a few things to consider. We do make sure to access the submission on the back end of REDCap, as I mentioned it right here. And we do a couple of things. We store it in the REDCap, and then we store it on an H drive. It's really just our kind of process to make sure that each agreement is stored on our process as well. And once an agreement is reviewed and has the necessary elements, we have the agreement signed by our signatory, Allison Lakin. And when it is signed by both parties, then it's termed as fully executed. So it means it's good to go. And sometimes we have submissions of agreements where it has been signed by us and we need the other entity to sign it. So regardless of which order it's signed or needs to be signed, then it will be fully executed. And then I mentioned the bottom before, if there are any missing data elements or incomplete information, again, we will reach out. And now question time. So Matt, can you please pull up my poll questions? So these really shouldn't be too hard, but have fun filling them out.
Sounds good. I think Natasha is pulling them up as we speak. There they are.
All right, there we go. So the first question, what does BAA stand for? Second, what does DUA stand for? And the third one, who is the document signatory for data sharing agreements?
And the questions are coming in. We'll give people about a minute to answer. Thank you for participating. All right, we're almost at 40% participated. We'll give it a couple more seconds for you to get your answers in. And
okay, so our first question, what does the BAA stand for? The correct answer is Business Associate Agreement. I think I kind of played a little, I made it a little bit tricky by adding a Business Assessment Agreement in the first one. But the correct answer is Business Associate Agreement. And the second question, what does DUA stand for? And that is Data Use Agreement. So we got 84%, so it's a very, very great. That's a B. So no, that's a very, very good response. And then the document signatory for data sharing agreements, that answer is Allison Lakin. So of course, we appreciate your participation with this as well. And then the next slide is contact information. So if you need to reach out to Christine, Lori Hopper, or myself, this is our contact information, email, phone number as needed. And yeah, thank you. And hopefully you guys learned something.
great. And it looks like we're running a little short on time, but does anybody have a question directly for Richard before we move on? You can either put it in chat or just speak up. Okay, doesn't look like anything's coming through, but again, the contact information will be sent out at about the end of the week. And Without further ado, I'll send it over to Lori Hopper.
Hey, everybody. Hey, Matt, just a real quick feedback. Can everyone see my first slide there?
We can.
Excellent. So then it looks like this is going to be the fastest HIPAA refresher course we've ever had. So here we go. I'm going to first quickly tell you what I'm going to talk about a little bit, maybe if I can get my slides to move forward. Let's see. All right, so something that's probably on everyone's mind. Most recently, we had some communication about a new annual HIPAA refresher in Skillsoft, so we'll touch on that. HIPAA, what triggers HIPAA to apply? What is PHI, a very important part of HIPAA? And the alphabet soup, some of which we've gone over already, so it'll be review of what both Christine and Richard have talked about. When should my HIPAA radar go off? And then what to do when your HIPAA radar goes off? And so because we're short on time, I'm going to tell you the answer to the last question first. What you need to do when your HIPAA radar goes off is reach out to us. We are here for you. We are your subject matter experts related to all things HIPAA. So that's not a trick question. If you can just remember the types of things that should make your HIPAA radar go off, we're here to help you. That's what we're here for. So that's the easy answer to all of the questions related to HIPAA. All right, so a quick screenshot of what you'll see if you go visit the CU Anschutz HIPAA homepage. It's pretty easy to get to. You can Google CU Anschutz HIPAA home and you should be able to get there using the first link, but we've got a link here on this page as well, bottom left. This is the memo that went out to the research community, and we're also sharing it here so that not only the research community, but all of the Anschutz community can have access to the information that we were intending to communicate related to HIPAA refresher training. The new part is that we're going to be doing this annually. The part that is not clear, and we want it to be clearer now, is that it's actually not due until June 30th of 23. So the date that was initially communicated and all of those trigger notifications were all hooked to an incorrect date. They were incorrectly put in as 2022. So apologies for that, but at least we have everyone's attention. I know that's a dirty joke related to HIPAA. So you guys can read that. I'll move on from that. One thing I will share though is a quick slide that I did for the School of Medicine, and Richard and I worked together to put something together for Michael Miller. Just for those folks who are providers, billing providers who take training through CU Medicine, and this is what it looks like. So if you're a visual person, if you took training that looks like this, that incorporated a HIPAA attestation, like you see highlighted there, then you don't need to take the training this time around. And when I say this time, we're talking about the training that's due by the June 30th of 23. So just a quick clear it up and clear it up again. So what's HIPAA anyway? HIPAA stands for the Health Insurance Portability and Accountability Act. Did you notice that? Not Health Information, Health Insurance Portability and Accountability Act. That was actually designed for some things that we don't think about when we think about HIPAA today. At least I would say the majority of us don't think about combating waste, fraud, and abuse and the accountability and portability of health insurance coverage. That was then. What is now? Now is HIPAA relates most frequently in our conversations about things like privacy, relates to things like privacy, the privacy rule, security, the security rule, breach notification rule. So how we use and disclose protected health information, how we use patient information, both in research and in all ways that information is used. And I would bet we're all patients somewhere. So we probably care about this, not only in the work that we do on a day-to-day basis, but because ourselves and our family members are patients and we care about how our information is used as well. So do we ever think about what triggers HIPAA? Or does it always just involve everything? Anytime a phone number is out there in my work world, should I treat it like it's HIPAA protected health information? Is it a certain dollar amount? It's not any of those things. It has to do with when we meet the definition of what is PHI. And in order to get into that, we have to get into the alphabet soup, right? So you see some of the words here, you don't see them all here, but I think we could expand this even further with lots more acronyms that you guys probably know about. So hopefully this is just a refresher. But the first one that I'll mention is covered entity. The university is kind of a covered entity and kind of not. And we'll get into that in a minute. But the hospital systems are covered entities. They are one of these three things. Healthcare providers, so doctors' offices and doctors themselves are covered entities. But the trigger is who electronically transmit health information related to HHS and transaction set standards. So payment for healthcare treatment, that sort of thing. The university is actually a hybrid entity. We do certain things that make us look a lot like a covered entity, and then other things that look a whole heck of a lot not like a covered entity, especially when you take into account that the university is not just the Anschutz campus, it's all 4 campuses. So the majority are actually not part of the covered components, the covered entity components, but we here on the Anschutz campus are. So that means HIPAA applies to those covered components. So it applies to us. I know that's in the weeds a little bit, but there's actually a link to an APS, the HIPAA hybrid entity designation, that lists out in the exhibit attachments every single department that is a covered department, a covered unit on the Anschutz campus. So it's an interesting and useful, at least for our team, useful for us in making sure we're handling the PHI correctly, treating information correctly as PHI. So what is PHI anyway? What's that definition? Well, here we go. Patient's information that relates to past, present, or future information. Why future? Well, because my upcoming visits to my doctor are in the future, and they may have diagnosis information and contact information. You can see where I'm going with that. There may be information associated with a future visit that most certainly is identifiable and relates to my protected health information. It is protected health information. It can be mental or physical health or billing information related thereto. And it connects to individuals by, here's something you guys have all heard about, the 18 identifiers. Those 18 identifiers, they can be tricky because they trick us into thinking they're the only things that are PHI when they're not. The 18 identifiers are PHI, and then all sorts of other information equates to PHI, but it's the 18 identifiers that need to be removed in order for PHI to be de-identified. That's a different way of thinking of it. So 18 elements don't make it identifiable, but it's the removal of those 18 elements that make PHI de-identified. Really important fact there. I keep looking over at my clock, you guys, so I just want to make sure I get you out of here on time. So all forms of that PHI, whether oral, written, or electronic, qualify as protected health information. Something to remember, this does not include, it excludes employment records. So think information that's HR related or FERPA related. These things are covered by other types of regulations, not specifically by HIPAA. All right, business associate. I'm going to go quick. Richard already talked about business associate agreements. So the business associate is actually the entity, the individual or organization who is performing that use or disclosure on behalf of the covered entity, or in our case, the hybrid entity. So if some vendor is doing some creating, receiving, maintaining, or transmitting, any combination thereof, then that is work being done on behalf of us as a covered entity. That makes that vendor a business associate. And we want to get them locked into taking care of and protecting that PHI in the same manner as we are required to as a covered entity. And so we do a business associate agreement with them. That's how we loop them in and get them tied to protecting that PHI in the same manner that we're required to under the HIPAA regulations. BAAs aren't always required, but I would say it's safe to assume that you need a BAA until you talk to someone on the team here, Christine, Richard, myself, and get a determination otherwise, because we would rather be safe than sorry when we're dealing with regulatory compliance. And covered entities, it's it's important to remember, can be the business associate of another covered entity as well. We can be doing something for another covered entity and vice versa. The data sharing request portal, yada, you guys, this looks like a lot of review and reminders. So I'm going to skip right over that. I hope this is review and reminder as well. The 18 identifiers listed here. What has to be, something Richard didn't get into the weeds on, but what has to be removed in order for us to be dealing with a limited data set are all of the 18 identifiers except for number 2 and 3 that you see listed here. So except for geography related things that fit that definition that you see there, and all elements of dates except for year directly related to an individual. And that could be, you know, dates of admission, dates of discharge, death dates. You see everything listed there. I won't go into detail, but you'll have this for your reference. Data use agreements do something very, very similar as business associate agreements. They just align with limited data sets, whereas business associate agreements align with fully identifiable PHI. So there's nothing fancy there, just limited data sets line up with data use agreements. They are different though than data sharing agreements, not the same thing. So data sharing agreements are kind of a generic term. Data use agreements, that's a definition that's used in HIPAA, and it means a very specific type of agreement that lines up with that limited data set. Confusing? Definitely. This is not something that we expect you guys to know off the top of your head. If you do, that's fantastic. You can be an honorary member of our team. But I would just say if it's confusing and you need help, when in doubt, just reach out. We're here to help. All right, another tool as a takeaway. This is a nice little, Christine actually shared this over. This is a great way on a one-page document to be able to tell the difference between all of these things that we're talking about, including FERPA information. So I've overlaid it with a quick, this lines up with BAAs, this lines up with DUAs, and this, what does this line up with? De-identified information. Well, technically, if it's de-identified, HIPAA is not in play. So we don't actually have a requirement under HIPAA to do any type of an agreement. That doesn't mean that the different parties might not want an agreement. They may very well want an agreement. They may require an agreement, but it's not required by HIPAA. So that's two different things. Keep that in mind. All right, Natasha, can you help us with a quick quiz? And we may be close to ending on time. I think we've got about 5 questions today, guys, and some of them are reviews. So this should be easy. We'll give just a minute or two. Matt, I'll let you tell us when we're ready to go.
Sure thing. The poll is up. So please start answering the questions. And it doesn't look like I can see the participation amounts on the poll. So Natasha, if you can see it, there they go. It's just lagging a little bit behind.
I understand that feeling.
So on the looks like we got about 3 minutes left, so we'll let it go for about maybe another 30 seconds. So if you guys are still on the call, please fill us out, and then we'll move on to a Q&A with Lori for the last about 2 minutes if anybody has direct questions for Lori. We're getting close to
Close
like
to
it's
critical
slowing
mass.
down a little bit, so we can go ahead and in the poll get your answers in last minute if you're there. So Lori, can you see the answers?
I can. I'll run through them real quickly. You guys are exactly right. Healthcare privacy was not the original intent of HIPAA. It was related more to insurance and portability. PHI, you guys are spot on. Protected health information. BAA, this is review. Business associate agreement. I love that 95% right there. Very good. And who can sign? Again, review. This is Dr. Lakin. She is the sole signatory for these types of agreements. So you guys spread the word. We don't want folks signing things thinking that they have got things done when it really needs to come to our office. That's really crucial. And let's see, de-identified, you need to have all of the 18 identifiers pulled away. And we got 100% correct on question number 6 because all answers go. I love it.
As a
All
freebie.
right. Look at
So
that.
if anybody has any questions for Lori, please put them in the chat, or you can just unmute and speak up. We've got about a minute left, but we'll hang out for a little bit while you guys have any questions. And if you don't have any questions, feel free to log off. As we see the room get a little smaller, we'll know that there's no more questions. Thank
Hi.
you all
Sorry,
for,
Matt. This is Claudia. I have a quick question.
Yeah.
I am affiliate with Children's Hospital, and I just had a quick question to see like, your thoughts. What happens when a provider of, employed by CU, but is works at Children's Hospital, sees children's patients, but they are part of Children's Oncology Group, and were reached out to do like a review of data they collected for a research project, but they're not an investigator of that project? What do you do in the instance where I guess it's kind of like they're being a subject matter expert to review the data they collected?
So let me make sure I've got what you're asking correct. I think you're saying if in your role at Children's, you are asked to do something that may be kind of alongside of your role, but not specific in your role, are you okay to be looking at that information? Do you need any kind of agreements in place? Is that kind of where you're going, Claudia?
Yeah, so the COG reached out to one of the PIs that I work with, and they provided an agreement, but I guess I got confused of which institution it needs to be routed to agree saying, yes, the data can be sent to this doctor to look at the data as a subject matter expert, but they're not involved in the research itself.
Claudia, is it data use, or is it more like confident? Are there elements of confidentiality in it also?
I think so, Christine.
So kind of, yeah, I think you're welcome to send it on and we can take a look, because there are definitely gray areas. There's a chance it could be some type of confidentiality agreement, and COG wants to make sure you keep that safe and secure. I mean, kind of the 411 is like, where's the data going? Is it going to be on CU servers? Is it going to be on children's servers? A lot of times those are, as you know, like the questions are, which institution should do the agreement, like in the typical data sharing.
Yeah.
But this is a bit of a right turn. So it probably behooves us just to take a look at some of the language to understand really the real intent. And that brings me to a point, which is, most people are gone by now. You got to sometimes look beyond the title, because really the meat of what someone's trying to accomplish is within the specifics of the agreement. So this sounds like it's one of those situations.
Yes, it got very confusing very fast, and Children's Legal, no offense to them, but they made it even more confusing to me. So I'm actually really happy you guys are here at this meeting today. So, okay. Do I send it over to you, Christine, or Lori?
Yeah.
Or this person?
Happy to take it. And then I'll take a look at it. And if for some reason, if it's, and the other thing too, maybe it's confidentiality mixed with something else, and we would potentially work with Creo, if assuming, we think it needs to be with the university. But yeah, we can certainly loop in the right folks as well.
Okay, perfect. Thank you, Christine and Lori and Richard, for a great presentation.
Thanks, Claudia.
Thank you.
Thank you, Christine.
If you guys have a second, I have a question as well, or kind of a general question. So in terms of HIPAA applying to screening and pre-screening for research studies, there's been a lot of confusion on what we're allowed to do in terms of reaching out to specifically so looking at the medical records and or reaching out to other UCH patients that are seen in different departments that are not seen by our clinical investigators. And I'm not clear on if that's a HIPAA question or not, or more of an IRB question, but that's just one of the things that has come up recently.
I see John on, and I don't want to, Nicole, let me just say, I would want to go and dig in the regs because there are the few exceptions to treatment payment and healthcare operations as far as how we can